Hi, today's lecture is about the pelvic cavity. The pelvic cavity is made up of the pelvic bone, which consists of three sections of this bone. The first one is the iliac bone, pubis bone, ischium bone. Now coming back to the top, the iliac bone is made up of anterior superior iliac spine, anterior inferior iliac spine, and more importantly, the iliac crest. Sometimes cancer wards, the doctors there might take a biopsy from this bone because it's very superficial and there's not really any major structures that if you do end up puncturing something over here a little bit that you will do damage, any serious damage that is. So a good anatomical landmark to know. Down here, this opening over here, it says foramen. This is called obturator foramen. The head of the femur is going to go into this socket. That socket is called the acetabulum. And right here, this is the head of the femur, the neck of the femur, and here you could actually see the greater tubercle and the lesser tubercle. Now back here you see the sacral bone. The sacral bone has these holes called foramen. So this is from the front side, so we call this the ventral sacral foramen. And the same holes from the back side would be called the dorsal sacral foramen. This is called the coccyx. The top part of this sacral bone is going to be called the sacral promontory because it's a very prominent bone that looks like a body of the vertebrae. Lines that connect the foramen right here, between each foramen, they're not so prominent here. There's supposed to be lines here between each one of these holes. That is called the transverse lines. Now if you rotate this image to the back side, there's a crest right down the middle. This is called the median sacral crest. One more thing that you should know is that this opening over here, this is the pelvic inlet. And from the back side, the pelvic outlet would be on the back side. As you know, females have a wider pelvis than males due to the nature of pregnancy and the baby passing through this area. So they have a wider base. Also, they have a lower center of gravity and can balance a lot better than males.